I wanted to take just a couple of minutes. I talked last year, or maybe it was early this year, gosh, time has kind of gotten by for me, at length about the Veterinary Professional Associate, or the VPA, which is this mid-level position that's been proposed within the veterinary profession. And as some of you may remember, in Colorado, the ballot initiative 129, Proposition 129, did pass in Colorado. And so now Colorado's licensing board is tasked with creating rules and regulations for what this individual is going to be able to do within the proposition that is already passed. And so if you may or may not recall, I certainly have some concerns about what this VPA is going to do in terms of their capability, their scope of practice, but in addition, I'm worried about this in terms of the health of the animals that may be treated, and the potential public protection or maybe lack thereof for these individuals. So we know of 2 schools currently that are creating programs. The one most closely associated with this is the program at Colorado State University. And so the proposed program is essentially 5 semesters long. 3 of those will be online. 1 is on site at Colorado State, and the final semester is kind of like a practicum, or sort of an internship is maybe the most basic way to describe that. And what we don't know, and what Colorado is working on right now, is what level of supervision will veterinarians be required to have over the VPA. And so with our veterinary technicians in a lot of our states, we have direct, indirect, immediate are probably the most common levels of supervision. We don't know yet what that's going to look like for the VPA. And so immediate supervision is like I'm literally, as a veterinarian, standing in the room right next to the person when they're performing the procedure. Direct is I'm in the building or on the premises, very quickly accessible. And indirect could mean that I'm not, as a veterinarian, on the premises when these things are taking place. And so Colorado is tasked with determining the level of supervision for VPAs under veterinarians by January of 2026. The credentialing exam is still yet to be totally figured out. The complete scope of work of these individuals is also something that's quite under discussion. And the biggest concerning areas, I think, are around diagnosing, performing surgical procedures, and providing prognoses, and potentially prescribing. Those 4 things are historically a veterinarian-only task, but this would allow for VPAs to perform surgery. Now, the proponents of VPA say this individual is going to be trained and able to do even abdominal surgeries, including spays and intestinal surgeries, bladder surgeries, things of that nature. And of course, those opponents are against any surgery potentially being performed, or really limiting what those surgical procedures might be. And so that is a big area of conversation right now. The establishment of the VCPR, which is the veterinarian client patient relationship, is also right in question right now. So usually the VCPR is held and established by the veterinarian. And so what that means in most cases, in a general term, is that I have performed an examination on this animal, or I've been on the farm, I'm familiar with that herd, and I understand and have accepted this patient as my client, and the owner is someone that I have a relationship with, and so therefore I'm able to make a diagnose, prescribe, potentially recommend surgery and other treatments. What we don't know right now is where the establishment of the VCPR is going to be. Is that going to be with the veterinarian still, or is it going to be with the VPA? Questions arise in both stages, and I'm not going to go into the full depth of that here. I just want to kind of, scrape the surface of what's happening. And then the other, questions in the air that are still out there are, what will the community think of this person? Will they think that they're a veterinarian? And so how do we protect maybe the title of a veterinarian? How do we protect the title of our veterinary technicians or veterinary assistants? Because these individuals will not be any of those 3, at least in all likelihood. And so there is a lot of conversation going around back and forth. And the Colorado Licensing Board is really the one tasked with a lot of the work right now. So by January of 2026, those rules and regulations need to be sort of laid in stone or as close to stone as they can be. And so there's a whole series of public hearings and feedback that have gone on. There's actually a hearing coming up this week on May the 7th, and you are certainly more than welcome to submit, comment, and or attend that meeting. I will drop a link in how to find that out. As of today, I looked and I think there's about 140 pages worth of comments that have come in. And on the whole, there's about 80, maybe up to 85% of the comments that are against the VPA and sort of not in favor of this being created or really not wanting to open up surgery to those individuals. And there's about 15 to 20% of people, maybe more like 15, that are proponents, and there are some that are like, ambiguous or neutral on it, which makes a lot of sense. In terms of who's commented, it's been a lot of veterinarians, it's been a lot of veterinary technicians, it has been other licensing boards, it has been other veterinary associations. So the Colorado Veterinary Medical Association has left comments, the American Veterinary Medical Association has left comments, and on the licensing side, we have seen commentary as well from the AAVSB, which is the American Association of Veterinary State Boards. So they oversee, and their members are their licensing boards of the US and most of Canada. And so you can certainly look at who makes up the licensing boards or who makes up the AAVSB. So, again, there's individual comments, there are group comments. You are more than welcome. Those are public. You can look at them and read them for yourself. Again, those will be linked on the website that I'll share here. And if you want to share some feedback, I would encourage you to do so. The way we're going to make this as safe as we can is to put the commentary out there from the public and get it out there from the veterinary community as well. So I think I just wanted to share that this meeting is coming up in later this week, and that you are welcome to sign up and attend that. I suspect that a lot of the feedback from it will make some of the news waves as well, but I just wanted to share that. So we're right in the middle of this, at least in what's happening in Colorado. The conversation is going to continue to come to other states. And so for those of you that are within the profession, I want you to be aware and stay as much on the know of this conversation as you can. And for those of you who are general public members, maybe you're a pet owner, maybe you're a producer at a farm, this original plan was meant to fill a gap for rural and large animal medicine, and now the program that's actually created is only for small animal. And so I have some concerns that it's actually going to help with the potential access to care issues, at least in those certain regions. And so I want to hear from you as well. And, we all want to make sure we're doing the right thing here. And for me, the right thing is making sure that we're protecting the public. We're being very clear about what these people can and cannot do, and that we are speaking holistically as a profession, but ultimately our job is to protect the animal patients in front of me, the animal patients that are not directly in front of me, and of course, protect you as a public member and consumer. So I would be curious to see what people's feedback is. Again, happy to hear your thoughts. This is an ongoing conversation. It will continue to evolve. If you have feedback, please don't hesitate to send it my way. And also send it to Colorado, send it to Dora, because they want to know what we're thinking out in the community. So thanks so much for listening. Really important conversation going on, and looking forward to continuing to watch this evolve over the next many months.